Good day, my name is Jane Pilot. I am CEO of Pilot Performance Resources Management Inc., based in Canada. My topic today is healthcare waste diversion from landfills and destruction. I'm a certified auditor providing services since 1994 in management system implementation and auditing for environment, health and safety, and quality to international standards. I am author of 2 books, Driving Sustainability to Business Success by Wiley, which came out in 2015, and ISO 9001 Implementation and Integration with Environment, Health and Safety. My background in the environment includes waste management as district manager for Canada with Browning Ferris Industries, setting up medical waste disposal in Canada, starting a number of international environmental firsts from the diabetic depot system, international waste disposal, and pharmaceutical disposal programs in Canada. I assisted No Waste Technologies in Ontario in the recycling of incontinence diapers. I have been the chair of the Public Liaison Committee for Energy from Waste since 1993. My 30-plus years in the environmental industry includes being active with Air and Waste Management Association, Ontario Environmental Industry Association, and co-chair of the City of Brampton's Environmental Committee for over 6 years. Healthcare is in business to protect patients, to reduce health problems, but at the same time, these facilities create waste containing harmful microorganisms that can be dangerous to public health when disposed of in landfills. Waste comes from healthcare facilities such as hospitals, ambulance care, mortuaries, funeral homes, autopsy, laboratories, nursing homes, animal research, blood banks. Some of this waste that comes from healthcare facilities such as the hospitals and ambulances, etc., are classified as biomedical waste and are managed under government regulations for the disposal of the waste. In Ontario, Canada, biomedical waste is managed under the Ministry of Environment Guideline C4. Types of biomedical waste. We have sharps, needles, hypodermics, sutures, glass, scalpel blades. Then we have human or animal anatomic waste, cytotoxic waste, that comes in contact with human blood. And this goes into a red bag or a container waste, whereas the sharps go into a sharps container. Human animal blood waste, microbiology laboratory waste, is put into yellow bags or containers. We also have discarded medicines and cytotoxic drugs that is medical waste as well. These wastes are sent for treatment and disposal, and treatment for destruction of biomedical waste can include autoclave and incineration. In some cases, this waste, after being treated, is sent to landfill. Many landfills, however, refuse biomedical waste at their landfills, and the autoclaved waste then goes to the incineration process. A needle stick injury from a discarded needle should be treated as if it is carrying a disease. The healthcare facility uses sharps containers, as I mentioned, for the control of this waste. Used needles may injure hospital workers, waste management people, or the public, and can spread germs causing potential infection or diseases such as hepatitis, tetanus, syphilis, HIV, or AIDS. We need to be concerned about the waste from healthcare facilities that are not classified as biomedical waste, such as dressings, incontinent products, blood-spotted beddings, wipes, cleaning materials. Healthcare facilities specialize in reducing health problems, but at the same time create waste that can be hazardous to people's health. Waste produced in these types of facilities carry a higher potential for infection and injury than any other type of waste. Infectious disease is a never-ending threat. This is caused when a bacteria, virus, or other microbes enters your body and begins to multiply. Disease occurs when the cells in your body are damaged. This is when your immune system springs into action. Chronic diseases are rising, and therefore the need for disease management. Our population is aging and the prevalence of chronic diseases is rising. Therefore, the need and importance for disease management. Healthcare waste contains potentially harmful microorganisms which can not only infect patients, healthcare workers, but the general public. Other potential infectious risks may include the spread of drug-resistant microorganisms from healthcare establishments, says the World Health Organization. Health Matters. The Conference Board of Canada report outlined by the Chief Public Health Officer that staph infection rate increased more than 1,000% from 1995 to 2009. Imagine 1,000%. And that 80% of common infections are spread by healthcare workers, patients, and visitors. Infectious diseases are the never-ending threat to public health. It was surprising for me to find out that more than 200,000 patients get infections every year while receiving health care in Canada, and 8,000 die as a result. The World Health Organization stresses the importance of disease management. There are threats of new and stronger viruses, and infectious diseases are becoming resistant to antibodies and chemical disinfectants. Every day there are reports in the news related to health issues. New viruses spread by mosquitoes, such as the Zika virus, which we're hearing about now. Flesh-eating disease. In May of 2015, a mother in Windsor, Ontario died after giving birth with the flesh-eating disease. Health Canada's online information site says flesh-eating diseases are estimated between 90 to 200 cases a year in Canada, caused by Group A strep, with 20 to 30% being fatal. In April of the same year, a Brampton, Ontario mother, after giving birth, died of a Group A streptococcal blood infection. What we're hearing right now, the Ebola virus, hit Ontario in April 2015. Hospitals were notified by the Chief Medical Officer of Health. But what about the waste handlers, the funeral homes, the public? When I checked with the communication of this directive, found only certain hospitals were aware of it. Policy needs to be set that outlines when there are outbreaks, like the Ebola, that not just the hospitals are notified, but the services that support these hospitals, the government that manages waste management, the waste handlers, the funeral homes. The National Center for Emerging and Zoonotic Infectious Diseases reported 1 in every 25 patients has an infection. Wow! The risk of infection is magnified in hospitals, long-term care facilities, nursing homes, which can spread from patient to healthcare worker to the public. Who knows, or who is responsible to know, if the waste going to regular garbage from a healthcare facility contains infectious pathogens? Where are incontinence products and disposable bed liners and diapers go from a hospital or care home? To a landfill in most cases. With 1 in every 25 patients with an infection, waste from healthcare facilities and in homes should not be going to landfill. CTV News reported on the 10 pathogens that cause the most health problems in Ontario. Does the public, government policy makers, or healthcare administrators pay attention to these news items? If so, why are we still putting healthcare waste and municipal waste that contains healthcare waste into landfill? The biggest health burden in Ontario is related to these top 10 pathogens: hepatitis C, streptococcus pneumonia, HPV, hepatitis, E. coli, HIV/AIDS, streptococcus, influenza, etc. Infectious diseases are not going away, says the study released by the Ontario Agency for Health Protection and Promotion and the Institute for Clinical Evaluation Sciences. Nearly 5,000 Ontarians die every year from infectious diseases. Staph infection is the main cause of hospital-acquired infection, with 160,000 infections requiring sometimes intensive medical care each year in Ontario. Staph infection can go into the lungs, bones, or blood system, spreading to organs and causing life-threatening infections, leading to death. Infectious diseases can spread. How? Through the air, through food or water, from person to person, contact with bodily fluids, blood, feces, improper handling and control of the infectious waste, or by vectors such as insects and animals, like the mosquito with the West Nile virus, and now the Zika virus. Germs can reproduce outside or inside the body with the right conditions. One germ can multiply into 64 billion germs in just 12 hours. Proper disinfectants need to be used. Transmission of infection requires 6 elements: an infectious agent, a reservoir, portal of exit, mode of transmission, how it moves from one place to another, which can be through contact, through droplets, airborne, a portal of entry, and a susceptible host, a person susceptible to the disease who lacks immunity or resistance to prevent the infection. Does infection control stop at the door of the healthcare facilities? Public healthcare has been doing excellent work in infection control, as well as environmental and occupational health support within the facility of the hospital, the nursing home, etc., wearing protective gloves, gowns, and washing. But what about outside the facility? Public Health Ontario outlined in their environmental cleaning toolkit on the internet how to clean and dispose of blood and body fluid spills. This is a quote from this. Dispose of the material by placing them into regular waste receptacle. If the soiled materials are so wet that blood can be squeezed out of them, then they must be disposed of in the biomedical waste container, which is a yellow bag. So, blood on the healthcare paper towel, absorbent material, or in an incontinent, goes into regular garbage. The risk of infection is magnified in hospitals and long-term care facilities. It can spread from patient to healthcare worker by touching contaminated surfaces, such as bathrooms, toilets, and equipment. Patients' cleaning tissues, bed liners, incontinence bandages contain potential infectious material, which are disposed of in black garbage bags going to our landfills. Plastic bags provide the environment for bacteria to grow. Healthcare waste, bloody paper towels, absorbent materials, or incontinence, diapers, are put into the plastic bag and sent to the landfill. The plastic bag creates an environment that can promote the growth of bacteria, living off of the blood or the urine or the feces from the absorbent materials, supported with the warmth and the darkness within that plastic bag, waiting for disposal or sitting at a landfill. The World Health Organization reports safe management of waste, and in that report outlined that very few data are available on the impact on medical and support workers from most healthcare waste. But this should not prevent the use of sensible measures for safe waste handling and treatment at every health care facility. How does hospital healthcare workers know if the waste they are disposing of contains potentially infected material when they put it through regular garbage? Infection control practices in hospitals have been designed to protect the patient and the healthcare worker. But what about the waste handler and the public? It is known that actual cases of waste being demonstrated to cause an infection in healthcare staff and waste workers are rarely documented. All individuals coming into close proximity with healthcare waste are potentially at risk from exposure to a hazard. We need protection for patients and for the public. The Windsor Star report in May of 2014 did this story entitled "Risky Business, Life-Threatening Risks to Waste Haulers, City of Windsor." In the last 2 years, there were 6 to 8 injuries to sanitation workers from sharps and garbage. "They pose a huge risk to our collectors," said Anne-Marie Elbadon, City of Windsor's Environmental Service Manager, as quoted in the paper. The city warns the public to never put such sharp objects, hypodermic needles, syringes, lancets, medical finger stick devices used for testing, in the trash. Instead, the sharps should be put in an approved yellow sharps container. While I was working with BFI, I set up the first diabetic depot system in the world for the disposal of needles in the homes through the pharmacies. This spread across Canada and the US. The first depot system was set up in Vancouver, British Columbia. The value of reputation. The reputation of a hospital or healthcare facility matters not only to the patient it serves, but to the community. It can have an impact not only on attracting patients, but investors in new hospitals and for potential equipment. But potential international business, new physicians, and workers, will they want to come to a hospital that is putting potentially infectious waste into landfill? Good question. Healthcare facilities have a social responsibility, a community responsibility, and an environmental responsibility in the decisions it makes to manage its waste. EPA developed the non-hazardous materials and waste management hierarchy in recognition that no single waste management approach is suitable for managing all materials and waste streams in all circumstances. The hierarchy ranks the various management strategies from most to least environmentally preferred. The hierarchy places emphasis on the reducing, reusing, and recycling as key to sustainable materials management. And I definitely do support the reduction and the reuse of materials. The least preferred being treatment and disposal. Treatment can be physical, it can be shredding, chemical incineration, and biological anaerobic digestion. But what we need to look at is what is the cost of the disposal through anaerobic digestion compared with incineration or energy from waste. I believe it is a lot more expensive. Landfills are the most common form of waste disposal. We need to look at who owns them. Who owns these landfills? In a lot of areas, it's the government. So therefore, they want to collect the monies for disposal at their landfills. In others, they are privately owned. Modern landfills have liners and follow state or provincial and federal regulations. Methane gas is a byproduct of decomposing the waste in a landfill, and it can be collected and used as fuel as well. After a landfill is capped, says EPA, the land may be used for recreational sites such as parks, golf courses, and ski slopes. But I wouldn't want to live on this type of land myself. Healthcare facilities need to do their source reduction, recycling, and then their waste can be used to produce energy. Ontario Hospital has the Green Hospital Scorecard, which is a benchmarking and recognition program reflecting the Ontario Hospital's environmental performance. Its 2013 reporting data suggests that the average composition of Ontario hospital waste consists of 34% diverted waste, that's the recycle, the reuse, and the compost. 7% of their waste is biomedical waste, blood soaked, and sharps. 59% is non-hazardous. That's the waste with the blood on the incontinence and the wipes that goes to a landfill. That's 59% goes to landfill. Ontario hospital sector in 2013 generated approximately 64,560 tonnes of general non-hazardous waste, and 31,102 tonnes of waste was diverted from landfill. This is approximately 1% of Ontario non-residential sector waste destined for disposal and 4% of diverted waste, as referenced through the Green Hospital Scorecard data. Healthcare waste going to landfills creates a huge environmental impact and health and safety hazard. Landfill waste attracts birds, wildlife scavengers, mosquitoes, which introduces a risk of reintroducing microorganisms and spreading infectious agents from this healthcare waste. CTV News in October 2011 reported 6,000 dead birds were washed up on Georgian Bay shoreline near Wasaga Beach, Ontario in Canada, due to botulism. Interesting. Where does the waste come from? Where the waste comes from and what possible or probable risk and impact the waste can have is where we need to start to address setting policy and purchasing decisions for waste disposal methods. An organization is legally responsible for its waste. Stop the spread of potential infectious waste. The composition of the regular waste from a healthcare facility, hospital, care home, laboratory, mortuary, etc., has a probability of infectious waste. How to stop the spread of potential infectious waste? The solution? The solution is diversion and destruction. Total diversion of healthcare waste from landfills, and total destruction of potential infectious waste through energy from waste or waste to energy. This is the only way to ensure that this waste is managed and controlled. Energy from waste inactivates disease agents and eliminates the opportunity for the spread of potential infectious pathogens at a landfill. We can create energy from this waste, which can be used as a resource. Healthcare can make a difference. Presently, they are segregating their waste into 3 categories. They will receive value for their money, knowing that they are diverting waste from landfills and producing electricity, as well as total destruction of potentially infectious waste. Healthcare sector, by using energy from waste, is greening and protecting. It enhances the reputation of the healthcare to protect not only the patient, but public health. There will be total destruction of potential infectious waste from healthcare facilities, inactivating those disease agents and eliminating the spread of potential infectious pathogens. Hospitals in Ontario will meet the Green Hospital Scorecard benchmarking for diversion, adding another 64,560 tonnes for diversion from landfill. And healthcare is using potential infectious waste and producing a resource, energy. If all hospitals had this technology, they could be producing their own energy to manage their facilities, as energy is a costly expense. By using EFW and not long-hauling waste to landfills, which are usually far away, healthcare will reduce the CO2 emissions or the greenhouse gases coming from these transportation vehicles, which impacts climate change. As well, our roadways would have less traffic and therefore less repair costs. And what about accident injuries? Getting the trucks off the road. Incineration was used by many hospitals in the 80s and 90s. However, the technology that was used was built for disposal of body parts and not healthcare materials, which were made of plastics and metals, which requires proper emission controls. Therefore, under Ruth Greer, Minister of the Environment in the early 90s, came the closure of hospital incinerators that had not been retrofitted to handle the plastics and metals that comes with the medical waste, new materials for disposal. Incineration technologies have changed with pollution prevention, stack emission controls. Emerald Energy from Waste in Brampton, Ontario has diverted over 2.5 million tonnes of waste from landfill. I have chaired the Public Liaison Committee for this facility as the watchdog under its certificate of approval since 1993, having gone through 3 owners as well. This treatment method has a sound track record of over 20 plus years since 1992 of managing energy from waste in the region of Peel and waste in Ontario since 2012. The facility has operated in compliance with its license with the Ontario Ministry of the Environment and Climate Change. It has 5 gasification units and it burns waste from municipal solid waste, commercial, pharmaceutical, international waste, treated medical waste, and it does product destruction contraband, and it produces electricity. The facility produces enough electricity to run its own operations and provide a neighboring paper mill, Norampak, with steam to run its operations. In 2010, the company invested over $10 million in air pollution equipment and refurbishment of boilers to ensure another 20 more years of reliable operations. Medical waste is a potent power source. I was interviewed by the Toronto Star for this article, which I've outlined to you the importance in this PowerPoint and presentation, the importance of total destruction of waste coming from healthcare facilities and its ability to produce energy. As Ziggy said, taking out the garbage is very therapeutic. It helps keep one in touch with reality. Healthcare is in business to protect not only its patients, but our environment. Medical waste in hospitals becomes municipal waste when the patient now lives in the homes and disposes of its medical waste through municipal garbage. The waste is the same, but the location is different. Policymakers need to look at the risks tied with the way waste is being handled. The spread of disease is what needs to be managed. Total destruction of healthcare waste is required, not landfilling. Let's keep our planet healthy. Thank you so much for listening to this video. If you would like to make contact related to any of the information within the video, you can contact me at 905-792-3130 or my email jpilot@pilotims.com. The presentation was intended to deal with the healthcare waste not going to landfill and to promote total destruction of potential infectious waste, keeping us all safe. It is copyrighted in 2015. Thank you for listening.